Whether you are recovering from a stroke, managing Parkinson's disease, or living with multiple sclerosis, muscle stiffness can make daily activities difficult. But don't worry, I have got some safe and easy tips to help you reduce that stiffness and get back to doing what you love. Hello everyone, I am Rachit, a physiotherapist at Next Step Physio and Neurorehab clinic. Today, we are going to talk about a common challenge that many people with neurological conditions face: muscle stiffness. First, let's talk about gentle stretching. Stretching is one of the most effective ways to reduce muscle stiffness, but it's important to keep it slow and controlled, especially after a neurological event. Start with simple stretches, such as gently tilting your head from side to side or stretching your arms overhead. The goal is to gradually lengthen the muscle fibers without pushing too hard. Just hold each stretch for 15 to 30 seconds and repeat a few times a day. Next, we have a range of motion exercise. These exercises are key to improving flexibility and maintaining joint mobility. For example, if you are dealing with leg stiffness, try sitting in a chair and gently extending your leg out in front of you, holding for a few seconds before bringing it back down. This helps loosen up the muscles and joints, which is especially important if you have conditions like Parkinson or stroke recovery where muscle tightness is common. Strengthening exercises might sound counterintuitive when you are dealing with muscle stiffness, but strengthening the surrounding muscles can actually reduce stiffness. Simple exercises like seated marching or leg raises are great for building strength without overexerting yourself. These exercises support your muscles and joints, helping to manage stiffness and improving your overall function. Another helpful strategy is heat and cold therapy. Heat helps relax tight muscles, while cold can reduce inflammation. Use a warm compress or a heating pad on stiff areas, especially after physical activity, to help muscles relax. Cold packs are great for reducing swelling if there is any inflammation, especially in joints or muscles that are particularly sore. Lastly, consistent movement is key. Staying active, even with light activities like walking in place or gently marching, helps prevent stiffness from settling in. Consistent, low-impact movement helps the blood flowing, which helps loosen up the muscles and improve overall function. Just remember, you don't overdo it. Start slow and gradually increase the duration as your body allows. Muscle stiffness doesn't have to be a permanent challenge. With the right techniques, you can manage and even reduce stiffness, making everyday activities easier. At Next Step Physio and Neurorehab Clinic, we specialize in helping individuals with neurological conditions regain their mobility and independence. If you are struggling with muscle stiffness or other neurological symptoms, don't wait. Reach out to us today to learn more and get started on your Parkinson recovery.
How often should I stretch to reduce muscle stiffness?
Stretching should be done at least 3 to 4 times a week, but if you are feeling tight, try to incorporate gentle stretches into your daily routine. The more consistent you are, the more effective it will be.
Can strengthening exercises make muscle stiffness worse?
No. When done correctly, strengthening exercise actually can sometimes help by supporting your muscles and joints. Just be sure to start with light exercise and gradually increase the intensity as you get stronger.
How long should I hold each stretch for?
Hold each stretch for about 15 to 30 seconds and make sure to repeat it 2 to 3 times for maximum benefits. It's all about being gentle, don't force it.
What's the best way to manage muscle stiffness if I don't have access to a physiotherapist?
If you can see a physiotherapist, focus on gentle stretching, range of motion exercises, and using heat or cold therapy. These methods can be done safely at home, and if you feel like it's not improving, it's always a good idea to reach out to a professional.
Can muscle stiffness go away entirely after a stroke or MS?
While some muscle stiffness may be permanent, the right rehabilitation can greatly reduce it and improve your function. The earlier you start rehab, the better your chances are for managing stiffness and improving mobility.